I need to share something that's been weighing on me for years, and I know the moment I say it out loud, some of my colleagues won't be happy about it. But after more than 20 years in medicine, after seeing what actually happens when people follow every recommendation that comes their way, I can't stay silent anymore. Here's the part no one really wants to admit. Sometimes, the most damaging thing you can do for your health is agree to too many tests, especially once you're over 60 or 65. I can already hear the reaction. Wait, isn't a doctor supposed to tell me to get checked for everything? Isn't prevention the whole point? And yes, that's what we've all been taught. Catch it early. Find it before it becomes serious. Stay on top of every possible issue. That message is everywhere. But what if that message leaves out the most important part of the story? The part about what happens after something is found. Because here's what those health screening commercials don't mention. Once something shows up, anything at all, even something that would never have harmed you, the process begins. And sometimes that process runs straight over your quality of life. Today, I'm going to walk you through 4 medical tests that, in my experience, often create more harm than benefit, especially for people over 60. I'm not sharing this to push you away from doctors. I'm sharing it so you truly understand what you're agreeing to before automatically saying yes to every test offered. Before we talk about those specific tests, there's something important you need to understand. It completely changed the way I practice medicine. It's called the Cascade effect. And once you recognize it, you can't ignore it. Here's how it works. You go in for a screening test. You feel perfectly fine. You're living your life normally. Then the results show something, maybe a small spot, a shadow, or a number slightly outside the normal range. That finding might be completely harmless. It may have been there for 20 years and could stay there for another 20 without ever causing trouble. But here's the problem. Once the doctor sees it, something has to be done. Because what if nothing is done and it turns out to be serious? So you're referred to a specialist. The specialist orders a more detailed test. That test shows the same thing, but it's still unclear. Now a biopsy is discussed, maybe a procedure, possibly even surgery. And every one of those steps carries risk: infection, bleeding, complications, anxiety, lost time. Here's the hard truth. By the end of all of that, 9 times out of 10, you find out it was nothing. It was never going to hurt you. But by then, you've spent months worrying. You've gone through procedures. You may even have had complications. And you're worse off than when you started, all because of a test you took when you felt fine. That's the cascade. And it often begins with a single test that may not have been necessary in the first place. So let's talk about the first test I see triggering this cycle again and again. This one is tricky because it sounds intelligent, modern, and proactive. I'm talking about whole body scans, full body MRIs or CT scans that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you from head to toe and catch anything before it becomes a problem. It sounds reassuring, doesn't it? Like getting a complete picture of what's happening inside your body. And I understand the appeal. The idea of knowing everything, of feeling in control, is incredibly powerful. But here's what tends to happen in real life. Let's say you're 65. You feel great, you're active, you have no symptoms at all. You decide to get one of these scans just to be safe. You lie in the machine for 30 minutes. A few days later, the report comes back, and there it is. A small lung nodule, 3 millimeters, about the size of a pencil eraser, or maybe a cyst in your kidney or a small spot on your liver. The report says, recommend follow-up imaging in 3 to 6 months. How do you feel at that moment? You walked in feeling completely healthy. Now you're being told there's something inside your body that needs monitoring. Suddenly, it's all you can think about. Every deep breath reminds you of that lung nodule. Every small sensation in your side makes you think about that kidney cyst. 3 months later, you return for another scan. Maybe it's still there. Maybe it looks slightly bigger. Hard to say. Now, the radiologist recommends seeing a specialist. The specialist wants to be thorough and suggests a biopsy. And a biopsy is not a small thing. It involves anesthesia. It means inserting a needle into your lung or kidney, wherever the finding is. It carries risks of infection and bleeding. Here's what research shows. When healthy people over 60 undergo whole body scans, something unusual shows up in almost everyone, 90 to 95% of people. Little spots, small cysts, faint shadows. The medical term for these is incidental findings, things discovered by accident, and the overwhelming majority of them will never cause harm. They're simply part of having a body that's been around for 6 or 7 decades, like wrinkles on the inside. But once they're discovered, they can't just be ignored, and that's when the cascade begins. Studies have followed people who chose to get these whole body scans. The results were striking. Those who were scanned did not live longer than those who weren't. They didn't prevent more disease. What they did experience were higher levels of anxiety, more depression, and more unnecessary procedures. The scans didn't make them healthier. In many cases, they made them feel sicker. So, what should you do instead? Instead, and this part really matters, I'm not telling you to ignore your health. I'm saying focus on the things that truly matter. Rather than taking pictures of your organs, pay attention to how your body actually performs. Can you climb 2 flights of stairs without getting out of breath? Can you stand up from a chair without pushing off with your hands? How steady is your balance? How well are you sleeping? These functional markers reveal far more about your overall health than any scan ever could. If you want a meaningful health checkup, sit down with a doctor who takes the time to talk with you. Someone who carefully reviews every medication you're taking, because I can almost promise at least one of them may be doing more harm than good. Someone who discusses your diet, your physical activity, and your social connections. Those everyday, boring habits are what truly determine your long-term health. A scan looks for problems that might not even exist. A functional assessment works to strengthen the health you already have. That's a major difference. Now let's move to the second test. This one hits close to home for many people because it taps into a fear we all share as we age. I'm talking about brain MRIs for minor memory concerns. Picture this. You're in your mid-70s. Occasionally you forget the name of an actor you like. You walk into a room and can't remember why you went in there. Completely normal experiences, the kind that happen to everyone with age. But maybe your children are concerned. They've heard about Alzheimer's disease and feel anxious, so they encourage you to get a brain scan just to be safe. I understand that fear. Truly. No one wants to imagine losing their memory or sense of self. But here's what you need to know. Ordering a brain MRI for mild forgetfulness is almost never helpful and often creates harm. Here's why. You get the scan. A few days later, you're reviewing the report with your doctor. It includes phrases like mild cerebral atrophy, age-related changes, white matter lesions, or small vessel disease. Those words sound alarming. They make it seem like your brain is deteriorating. But in reality, those findings are entirely normal for someone in their 70s. They describe what most brains look like at that stage of life. It's like scanning your skin and being surprised to find wrinkles or age spots. Of course, they're there. That's what 75-year-old skin looks like. The problem is the language. It sounds medical and serious. Suddenly, you're walking around believing you have brain damage. You start fearing Alzheimer's, even though your daily functioning is completely normal. Here's the frustrating truth. When researchers scan the brains of healthy adults over 75, more than 90% show abnormal findings on paper. More than 90%. And yet most of those individuals have perfectly normal thinking and memory. The image does not always reflect reality. I've seen people who are mentally sharp, reading books, managing finances, solving crossword puzzles, whose MRIs look terrible. And I've seen people with early dementia whose scans appear relatively normal. The picture doesn't always tell us what we assume it does. So what's the better approach? If you're concerned about memory, there are far more useful tools. Simple in-office tests that take about 10 minutes, remembering 3 words, drawing a clock, counting backward from 100 by sevens. These tasks measure how your brain functions, not just how it appears on an image. If those tests reveal an issue, then we investigate causes. And here's something encouraging. Many memory problems in older adults are reversible. It might be a medication causing mental fog, low vitamin B12. Depression, which often shows up as memory difficulty in older adults. Sleep apnea reducing oxygen to the brain at night. Thyroid imbalance. We check those factors first. And you'd be surprised how often correcting one of them significantly improves memory. No MRI required. We focus on function, not images. We treat the person, not the scan. Now, if someone is clearly declining, getting lost in familiar places, unable to manage finances, that's different. In that situation, a full evaluation, including imaging, makes sense. But for normal, age-related forgetfulness, an MRI usually creates more fear than benefit. Let's move to the third test. This one often surprises people because it sounds completely logical. I'm talking about cardiac stress tests, specifically putting someone on a treadmill simply because they've reached a certain age. Here's a common scenario. You're 72 and scheduled for routine surgery, maybe a hernia repair or knee replacement. Hospital policy says everyone over 70 needs a cardiac stress test beforehand. Even though you feel fine, even though you can walk a couple of miles without chest pain or shortness of breath, so they put you on a treadmill. Now think about that. If you can already walk 2 miles in daily life without symptoms, what is the treadmill going to tell us that your normal activities haven't already shown? Your daily routine is your real stress test, and you're passing it every day. But policy is policy. Here's where things become complicated. Stress tests in older adults have a high rate of false positives. That means the test suggests a problem when there isn't one. Maybe your heart rate doesn't rise the way it did years ago. Maybe medications affect the results. There are countless reasons unrelated to a dangerous blockage, but once a result is labeled abnormal, you're placed on the medical conveyor belt. Next comes cardiac catheterization, threading a tube through an artery up to the heart to examine the blood vessels. It's invasive and carries risks. Often, what doctors find is exactly what you'd expect in a 72-year-old heart. Some plaque, mild narrowing, nothing requiring stents or surgery, nothing about to cause a heart attack. But by then, you've undergone an invasive procedure. Worse, you've been labeled a heart patient. New medications are added, and psychologically, something changes. Maybe you used to play tennis. Now you're afraid to push yourself. A test meant to protect you ends up limiting your life. So what's the smarter alternative? Listen to your body. That's the best stress test available. If you can climb stairs, walk briskly, and carry out normal activities without chest discomfort or unusual breathlessness, your heart is likely functioning well. The symptoms that matter are chest pain with exertion, unexplained shortness of breath, dizziness. If those occur, absolutely get evaluated. That's when a stress test makes sense. But if you're trying to understand your future risk, there's a more targeted option, a coronary calcium score. It's a quick CT scan, about 5 minutes. No treadmill, no needles, minimal radiation.